Welcome to Crisis in Perception. This is where we examine the systems that, well, shape our world. And today we are taking a look at the machine that runs American healthcare, using a systems-level overview based on Thom Hartmann's incredible book, The Hidden History of American Healthcare.
But before we get into the gears and levers of it all, let's just start with a number. And this isn't some abstract statistic. We're talking about more than 500,000 families every single year being pushed into bankruptcy just because someone got sick. That's the human cost. And that's what's going to ground our entire analysis today.
So how in the world does a system produce a number like that? Well, here's our roadmap for this explainer. First, we're going to define the system itself, what we're calling the sickness for profit system. Then, we'll break down its core logic, this idea of a toll gate. From there, we'll see the predictable and often painful outcomes it creates. We'll look at how this machine protects itself. And finally, we'll see how it all connects to the larger grid.
All right, so first things first. To really get a handle on any system, you have to be able to name it. You have to clearly identify what it is we're actually looking at.
So, what is this system really? Well, the first thing to get is that it's not primarily a health system. It's a financing structure. And you can see the key design features right there. It's profit-driven, it's mediated by insurance companies, and it's tied directly to your job. Every one of those features was designed, and it determines who gets care and how.
And the results of this particular design are so consistent that, as Thom Hartmann points out, if this were any other kind of experiment, it would have been shut down by an ethics panel a long, long time ago.
Okay, so why does the system produce these results? To figure that out, you've got to examine the incentives that drive it. What is its fundamental logic? The best way to understand this core logic is with a metaphor. Think of the system as a giant toll gate. It's been built right between you and the care you need. And its main job isn't to help you get through smoothly. It's to stop you at a checkpoint and calculate how much profit can be made from your journey. Now this really shows you that toll gate logic in black and white. For every dollar you pay in premiums to a private, for-profit insurance company, only about 80 cents actually goes to your medical care. So where does the other 20 cents go? Well, that's profit and administrative costs. The incentive couldn't be clearer. The less they spend on your health, the more money they make. Just compare that to Medicare, a single-payer system, where 95 to 98 cents of every dollar goes directly to paying for care.
So when you design a system with that core incentive to profit by limiting care, you are going to get certain outcomes. They're not accidents. They're completely predictable results of the design. And here they are. It's so important to see these not as bugs in the system, but as features. All that administrative complexity, it makes it harder for doctors and hospitals to get paid. Denied care, that directly saves the insurer money. Medical bankruptcy, unequal access, it all follows logically from that toll gate design.
And this quote from the book just brings that complexity to life in a really powerful way. I mean, just imagine that for a second. Two highly trained medical professionals whose entire job is not taking care of patients, but just fighting the system so their patients can get the therapy they need. That is the toll gate creating friction, and it's doing it by design.
And the cost of all that friction, it's astronomical. We're talking $256 billion in a single year. And remember, that's not money for doctors or new research or medicine. That is just the cost of running the toll gate itself. Which, of course, leads to the really obvious question. If the outcomes are so painful, and it's so incredibly expensive, why on earth does this system stick around? Why doesn't it change?
Well, the crucial thing to understand is that the system protects itself. It's not just broken, it's armored. It creates this incredibly powerful self-reinforcing loop. The system generates these immense profits. Those profits are then turned around and used to fund lobbying. That lobbying power blocks any meaningful reform. And so, the system stays locked in place and the profits keep flowing.
And the scale of that political armor is just immense. I mean, look at these numbers. In just 1 year, these three sectors of the industry spent hundreds of millions of dollars on lobbying. That kind of financial force can just overwhelm the resources of anyone trying to push for genuine reform.
And this brings us to a really critical question, maybe the central idea of this whole analysis. When our public debate gets stuck focusing on the symptoms, the high price of one specific drug or the details of one insurance plan, are we actually experiencing a kind of crisis in perception? Are we all so busy arguing about the price of an individual toll that we fail to notice that the entire road is owned by the toll collectors?
Okay, so for our final piece, it's so important to see that this healthcare system isn't some isolated thing. It doesn't exist in a vacuum.
It's plugged into a much larger grid of interconnected systems and power structures.
It's connected to our system of corporate governance, which legally requires publicly traded companies, like insurance companies, to prioritize shareholder profits above everything else.
It's also plugged into the relentless demands of financial markets, which punish any company that doesn't show constant quarter-over-quarter growth.
And of course, it's deeply connected to our labor markets. By tying your health security to your job, that gives employers an absolutely immense amount of power over their workers.
And, as we just saw, it is fundamentally, inextricably linked to our system of campaign finance, which basically allows all that wealth to be translated directly into political protection.
Which brings us to our final thought. There's a saying in systems thinking, every system is perfectly designed to get the results it gets. So what if we stop seeing things like medical bankruptcy and denied care as failures of the system? What if we start seeing them as the intended results of a system designed first and foremost for profit? Well, when you look at it that way, the picture becomes alarmingly clear. Crisis in Perception examines how systems shape belief, and how better tools help us see clearly. This project is free and publicly accessible. If you'd like to support the time, tools, and research behind Crisis in Perception, you can become a supporter on Patreon. For a longer, audio-based analysis of this topic, see the deep dive linked in the description. If you enjoy this kind of systems-level analysis, please like, subscribe, and comment with books or topics you'd like us to explore next.